When we speak about vein disease, we speak about two general categories of disease. One is a problem with clotting in the veins, and the other problem is with the valves in the veins not working correctly, or some people call it venous insufficiency. Your blood returns from your legs using the muscular pumps of your legs to move the blood towards the heart. So as the muscles squeeze, the blood moves towards the heart, and then there are valves in the veins to keep the blood from coming backwards. We like to compare them to the door at the grocery store. You can go in the end door, but you can't come out. The valves are supposed to work the same way, so that as blood moves towards the heart, when the patient is not walking, sitting, standing, immobile, to prevent the blood from moving backwards, these valves catch the blood to keep them from moving backwards. In some patients, those valves become insufficient, or we say that the valves are leaking or they're not working appropriately, so that during the day, as the patient is sitting for prolonged periods or standing prolonged periods and not active, the blood can come through the valves and build up pressure in the legs. This can cause problems such as the spider veins, or the little reticular veins that you can see on the surface of the skin. As the disease is worse, it can cause what we call varicose veins, or those ropey, bulging veins that are seen underneath the skin. And as the disease progresses even further, it can cause prolonged swelling, can cause skin discoloration in the lower part of the calf, where the lower part of the calf becomes brown and the skin becomes very abnormal looking, and ultimately can lead to ulceration, and in its most severe form can lead to amputation. When folks present with a question of venous disease, the first thing that we want to do is to take a careful history and physical. We want to look for factors that may precipitate a clot that would make that patient increase risk for developing clot in their vein. Some of those factors would be their family history, would be a history of immobility, would be oral contraceptive or oral hormonal replacements. Those are all factors that would increase the risk of a clot. For patients that are having leaking valves, we want to again know if they've had a history of the bulging veins in their legs, if it's something that runs in their families. Was it worse after pregnancy? It can be affected by other factors. The treatment options depend on the kind of disease that the patient has. At the least severe end of the spectrum, where we have spider veins or reticular veins, veins just under the surface, those are treated with injection of a sclerosing solution that can close off the vein so it's no longer visible, and occasionally in combination with a skin laser device that can treat those veins again so that they're not visible anymore. Patients that have the more serious varicose vein disease, where the veins are bulging and there's a lot of leakage of the valves, the treatment really needs to be twofold. One is to stop the leaking valves, which we now do with a laser device to close off that vein that's leaking, and the other being addressing those varicose veins, those bulgy veins that have developed, making them go away. We can do that sometimes, again, still with the injection, and sometimes we perform what we call a microflebectomy, where we make a very small incision in the skin and reach in with a little bitty small hook and pull those veins out. Most of those are in-office procedures. We can perform procedures in the hospital if a patient chooses and they want to have a heavier anesthesia, but more than half of our patients choose to have that in the office, where it is totally with just local anesthesia. The vast majority of patients have a lot of symptomatic improvement after surgery. We always try to tell patients that we're not shooting for perfection, but we want the legs to feel better and to look better. And I would say the vast majority of patients have both, are pleased with both the physical appearance and the feeling in their legs as they move about each day.